Aloha, my name is Melissa Hill, and I'm an MSW candidate for the School of Social Work at Hawaii Pacific University. My presentation today will be on LGBTQ elders and concerns with long-term care. By 2030, as many as 3 million Americans over the age of 65 will identify as lesbian, gay, bisexual, transgender, or queer. Given increases in both life expectancy and chronic health conditions, it's not surprising that concerns about older adult care are taking on greater importance in LGBT communities. Potential concerns and fears of the elder LGBT community with long-term care include rejection, neglect, lack of acceptance by staff and peers, as well as concealment of sexual orientation or identity. Although social stigmas regarding different sexual identities are rapidly changing in the US, research on the psychosocial challenges and needs of LGBTQ elders in long-term care facilities have been sparse. The objective of this research was to explore the unique challenges and possible discrimination of LGBTQ elders receiving care and treatment in long-term care facilities. Due to the sparse research on LGBTQ aging, a scoping review method was chosen to allow for a more comprehensive exploration of qualitative, quantitative, and mixed method study designs of current literature. This scoping review included articles written in the last 20 years, between 2002 to 2022, that were retrieved from the electronic databases listed here in the blue box and utilizing the search terms listed here in the red box. For this study, elderly referred to adults who are age 65 plus, and the terms nursing home and long-term care were separated and defined as traditional long-term care facilities that provide medical, psychological, and social care for elders. Both terms were used in the search as the terms are interchangeable based on where the facility is located. The terms discrimination, mistreatment, neglect, and abuse were used to encompass all types of negative interactions that LGBTQ elders may potentially face in long-term care facilities. Here you will see a flow diagram of the literature search based on the inclusion criteria from the search terms on the previous slide and the exclusion criteria, which included articles that only focused on heterosexual elders, failed to address discrimination, end-of-life or hospice, short-term healthcare settings, and/or community settings. The database search retrieved 108 articles, and after 20 duplicates were removed, 88 articles remained. A screening of titles and abstracts then helped to eliminate another 32 articles based on the exclusion criteria. The remaining 56 articles were then selected for full text review, and another 6 more articles were excluded. The remaining 50 articles were then used for the scoping review. They included 36 qualitative, 8 quantitative, and 6 mixed methods papers consisting of personal essays and reflections. From the identified articles, common and recurring themes emerged. Social support and chosen family mentioned how families may not always be supportive of LGBTQ individuals coming out, and the rejection may lead to them forming families of choice, also known as lavender families. Fear of discrimination and distrust. Older LGBTQ individuals were noted to have concerns about the medical system, including fear of discrimination and distrust of health and social care providers due to actual and perceived negative experiences received by their peers and themselves. Disclosure of sexual orientation and/or gender identity. Past stigma, fear of prejudice, and discrimination negatively influenced their decision to disclose their sexual orientation or gender identity to healthcare professionals. Other reasons included that they may not have come out to their social or family circle, and also the fact that same-sex attraction was labeled as a mental illness by the APA up until December 1973. Staff's lack of knowledge and cultural competence was detailed through the absence of inclusive language on forms and the presumption of heterosexuality during interactions, causing added stress and discomfort. Lastly, staff's lack of knowledge of and biases toward sexuality and sexual diversity was described as the invisibility of LGBTQ elders in long-term care facilities, since staff believed they were not part of the population they served. One of the articles reviewed talked about how some nursing home residents and staff found discussions about sexuality uncomfortable and often viewed elders as post-sexual. People hope to be welcomed when they seek help, yet many LGBTQ older adults fear and may sometimes receive poor service and abuse when seeking assistance. This scoping review revealed that many LGBTQ individuals face past discrimination, which further exacerbated their expectation of rejection, discrimination, and potential violence against them in long-term care facilities. Although this research study provided preliminary insight into the challenges LGBTQ elders endure, there were some limitations to the research, which included primarily focusing on a majority of individual perceptions rather than actual experiences of discrimination, and perspectives of elder LGBTQ individuals being only from the US, which then limited the correlation of findings. Additionally, many of the articles used the acronyms of LGBT or LGBTQ. However, it was unclear if transgender or questioning individuals were included in the studies. Therefore, the research is not generalizable to the overall LGBTQ older adult population. Implications and future directions. Social workers strive to eliminate barriers to accessing services. This study highlights the existing barriers for LGBTQ elders and how social workers can better understand and support this disenfranchised community. As the number of LGBTQ elders increase, it is more imperative to expand service programs in ways that are responsive to the needs of LGBTQ individuals. Listed here are ways social workers can bridge the gap of inclusive programming and services through advocacy, training programs, increasing awareness, and lobbying for state and local laws to standardize and safeguard LGBTQ elders from discrimination. In conclusion, this integrative literature review identified a number of challenges LGBTQ individuals face when entering nursing homes, including potential discrimination and exclusion, which potentially limits the utilization of services. Due to the limited existing research, this scoping review cannot affirm actual discrimination among elderly LGBTQ patients in long-term care facilities. However, that does not mean that there isn't discrimination among this group. It just means that it hasn't been researched with these inclusionary criteria on a larger scale. Additionally, the limited research highlights the need to bring these two groups intersectionally, the elderly and the LGBTQ, into focus and bring more awareness for policy changes since their voices aren't heard and they are marginalized groups. Mahalo for watching my presentation, and I look forward to clarifying and answering any questions you may have on this study.